Hello everyone, my name is Ha. Today I would like to talk about varicella or chickenpox disease. Okay, so this is an introduction about the chickenpox or varicella virus. So the chickenpox is a contagious infection that caused by varicella zoster virus, or they have a different name, which is varicella virus, HHV, which is human herpes virus 3, or VZV. So I'm gonna call it VZV for short for now. So the viruses belong to the alpha herpes virus group within the Herpes viridae family. The features of the VZV can be characterized by their genomes, size of replications, or the outer covering components. So VZV has a linear, non-segmented, double-stranded genomes, DNA, which consists of 125 KB, which is kilobase, is located inside a nucleocapsid. So the site of replication is inside the nucleus, and the virus has had an envelope covering the genomes. The disease is worldwide contributed, but happens exclusively to humans. So there is no animal reservoir, and mostly happen during childhood. So this is the 3D models for the virus. You can follow this link or you can Google it. Follow this website and then the name of the virus. It's gonna lead you to this 3D model so you can take a look how it's in 3D. Alright, so what is transmission mode of varicella? So in the transmission mode, the virus mainly spread by the respiratory route, which is upper respiratory secretions such as droplet or aerosol. So you can be infected by inhaled in the viral particles through droplets from sneezing or coughing. And then you can also be infected if you sit inside a low ventilation area with infected people that they produce aerosol around that area. So however, the direct contact with the skin lesions is also a common mode to spread the disease. So after the entering the host, the VZV target the T lymphocytes, epithelial cells, and dorsal root ganglia of the nervous system to accomplish an infection. So what are the symptoms for varicella here? So actually, varicella virus can express into two different diseases. One is the chickenpox as a primary infections, and then the shingles as a latent infections. So in the primary infection period, after incubating for 7 days, the symptoms start to show, which include fever, malaise, centripetal rash on trunk, face, and later spread out to the rest of the bodies. Some would experience swollen glands and then abdominal cramps. So the VZV centripetal rash actually different from the smallpox disease, which is centrifugal rash. The chickenpox rashes appear as a erythematous base, which is redness on the skin, and then develop from that one is developed from the skin vesicles in the beginnings, and then progress to pustule, which is the vesicle filled with pus, and then the crusted scab as a final stage. So the pictures right here, you can see that this is a child that get infected by varicella, and then actually their average number of lesions is 300, which is newly generated from the virus colonies on the bodies, and then in the peripheral blood mononuclear cells. So although the varicella usually a benign disease to kid, but a large number of that lesions at once might cause a secondary soft tissues infection from the opportunistic organisms like streptococcus or staphylococcal bacteria. When after got infected by the primary infections, it's actually perform a latency phase. So that is one of the significant features of the herpesviruses, which is establishment of a lifelong latent infections of the sensory ganglion neurons called shingles or herpes zoster. The symptoms including painful visible rash with dermatomal distributions. So the shingles disease is resulted from VZV reactivations using enterograde transport due to the immunity reductions. It can be because of the advancing of age, or it's because of the individual is immunocompromised. So who is at risk? So the healthy individuals might not experience complication from chickenpox or shingles, but several groups of people can suffer from complications, leading to higher rate in morbidity and mortality, such as infants, pregnant women, weak immune system individual, HIV or AIDS patients in process of transplanting or chemotherapy, or taking immunosuppressive medication, or after a long-term use of steroid. So this picture right here show some acute complications happen in children, and then some acute complications happen in elderly patients that have been immunocompromised. So such as bacterial sepsis, pneumonia, encephalitis, hemorrhagic complications, and meningoencephalitis, myelitis, cranial nerve palsy, vasculopathy, gastrointestinal ulcer, pancreatitis, and hepatitis. So this is the VZV infographics. The varicella disease distributed worldwide, causing endemic every 2 or 3 years. The disease distribution is focused on the most in developed country and the country with high rate of HIV positive, such as Africa or India. The result from the viral genomic study show that the virus derived from Europeans, Asia, and Africa origins. So every year, chickenpox occur at 13 to 16 cases per 1,000 people, with variations in different climate patterns. So, for example, in a temperate climate, the preschool children, which from 1 to 4 years old, and the elementary children from 5 to 9 years old are at highest risk, more than 90% infected. And then the adult have a smaller susceptible percentage to the disease, which is less than 5 to 10%. The infection rate is usually high in winter and early spring. Meanwhile, in the tropical climate, so this is actually a tropical climate picture, the varicella cases appear to be more frequent and at a higher mean grade, which is 14.5, leaning toward the adult infection cases. The VZV outbreak peak in school and dry weather here, and frequently happens on children's gathering settings, such as like schools, playground, or summer camps. The infection rate is totally not impacted by genders. As a result, the differences in climate can play an impact on the infection rate, which might be related to humidity, heat, or factors that affect risk exposure. So the varicella vaccine is actually developed to prevent an outbreak and reduce a complications rate in infected individual, which is shown at the next slide. So as you can see here, after the vaccine invented, the number of cases declined by 95%, improving recovering rates and reduce the susceptible rates for unvaccinated age group because of the effects of the herd immunity and epidemics interruptions. However, since the vaccine can be won over time, the second dose booster are suggested to maintain the effects against the disease. Other countries that don't have the vaccine, they can use the passive immunization for several week temporary protection. So VZV can be prevented not only by vaccine but also by being cautious. So as you can see, washing hand can prevent the risk from all pathogens, not just VZV. Wearing masks in public, preventing catching droplets from the infected individuals. Limited direct contact, preventing transmission through open lesions, and then avoid crowded places, reducing the risk from contacting aerosols in the low ventilating area. So even though the chickenpox are usually self-limiting in most healthy cases, but educating local civilians about VZV plays a crucial role to reduce the risk of potential endemic. So I just wanted to talk about how my country, Vietnam, a a developed country with a highly contagious infection rate every year, since we lacked of VZV education. Vietnamese people believe that shingles come from bad luck. They're afraid of catching herpes zoster by mentioning its names. So the name is limited to use in a daily basis as it become a taboo. One of the ancient Vietnamese techniques that is still used by minority people to improve the shingle conditions is covering the lesion by chew green beans followed by a ritual sections. So the unsanitary beans usually lead to the secondary infection, but since shingles is self-limiting, the minority people mistake that their technique is effective. So, in brief, the chickenpox caused by VZV distributors worldwide, but infection rate depends on the climate, age, and age in each type of climate. The vaccine program declines all the infected cases in all age groups. So, childhood vaccination program actually successful in achieve the goals preventing outbreak combining with enhancing recovery rate. So this is the references that I use for the presentations. Thank you so much for listening.